everybody, and a very, very good morning to one and all. Thank you so much for joining us. If you're from my home city, welcome. I'm sure you've all settled quite very nicely in this very warm and friendly city of Metro Manila. A most apt and inspiring message from Wendy Kopp of Teach for All. I had her on the show yesterday, and I was really inspired about her message. Lovely speaking with her on the amazing journey that she's had in trying to narrow the educational inequity, if you may. Now, this session is all about people. That's exactly what Wendy had said, that Mark Zuckerberg had told her what Facebook's amazing success is all about, the human resource. And we wanted to make sure that all our people in our economies would actually be very useful and productive so they can make an economy grow. That's what we're here for in this morning's session, session number 5. I was so cheered to know that I'd be moderating this session because it's very close to my heart when you talk about health and education, both as an advocacy and as a lifestyle. So I'm honored to introduce to you my distinguished panel, my discussion leaders for this morning, starting with Kenneth Hartigan Go, the Philippine Secretary of Health. Nicolas Aguzin, the Chairman and CEO of JP Morgan Asia Pacific. Olivier Charmé, the President and CEO of Sanofi Pasteur. And Ramon Del Rosario Jr., the President and CEO of Finmac Corporation. Thank you so much, gentlemen. Please take your seats. Let's start with Nicholas. We know that JP Morgan is very involved with corporate social responsibility, but what about when it comes to the business point of view? What is JP Morgan doing about that?
Okay, thank you, Kathy. It's great to be here with everyone sharing this panel, and as you can probably see from the panelists, I'm probably the only one that is not directly engaged into education or healthcare.
Which makes us really unique.
Exactly.
We
However,
your presence.
We have almost 250,000 employees in the firm around the world, and the human capital is a key component of what we do, and the development of that capital is critical to the success of the firm. So there's 3 areas that we focus on in terms of dealing with issues related to education and healthcare. The first one is through our philanthropic efforts and corporate social responsibility. And there's a lot that we do there around encouraging the workforce to get ready for the new way of doing things. And we also focus on helping different NGOs around the world. We partner with them. So we contribute more than $200 million around the world, and a significant amount of the people helped are actually in Asia. So that's one area. The second area that I'd like to touch briefly on is relating to information sharing. There's not a lot of awareness of many of the important topics and issues, specifically as it ties to education. And one example that I'd like to draw the attention to is last week we held a symposium in Singapore around workforce readiness. And we teamed up with the Asia Society to set up a symposium where we brought together about 200 people, mostly from government, from academia, think tanks, and also private enterprises. And the purpose was to get all of them together thinking and discussing the issue of workforce readiness. Why is this an important topic? Many of you probably feel pretty excited about all the growth opportunities that countries around the world, especially emerging economies, have, and a lot of the countries represented in APEC. It's really exciting, it's great. However, it somehow feels that the more that we invest in things like education, there's at the same time a lot of young people that finish university and they still cannot get jobs. People are more educated, we invest more in education, companies are growing, they need more, but we still cannot match them. There's something wrong, something is not working. And what's missing is that there's a supply-demand imbalance. what we're producing is not really what a lot of the corporations need. So what we did is we put this group together, gathered people from all over the place. We commissioned a study to the Singapore Management University to analyze in detail around all Southeast Asia the supply and demand factors and how we can better match that supply and demand. So that's the second aspect where it's around information, finding, doing the research, and we funded all of that. That's more like the corporate social responsibility side. But for a lot of the CEOs in this room, I think what's also important is, as a business, and obviously, you know, we're in the for-profit side of the world. So why is this important, and how does it make sense? And that's another very critical aspect of what we're doing. We think that having our people healthy and happy and challenged is critical. If we have those employees doing very well, I mean, we'll have a great company that will be able to serve our customers. And one of the key things around that is that the business is becoming more and more global. And what we have an imbalance is that the countries that are growing, even though they have lots of graduates out of universities, sometimes it's hard to really get the right people that will thrive and succeed in a global institution. So we look at, for example, China, a country that is growing at a very accelerated pace. They have about 7.5 million graduates every year. However, when you try to recruit, sometimes they don't always succeed in a global institution. Part of that may be language. Part of that may be that they have different cultural ways of expressing themselves. So just like some of the soft skills don't particularly work in an organization, a global organization. Other times it's difficulty in understanding some concepts, like, for example, a hierarchical organization that also has a matrix. Many times when you think in China, there's a saying that says, one mountain, one tiger. People are used to having just one boss. Well, the reality is in a global organization, you have products, you have geographies, you have functions, you need a lot of matrices, there's a lot of consensus. Sometimes you have 2, 3 bosses. Sometimes you have to share like people with other groups. I mean, it's complex. So what we're doing around that is we're spending a lot of time teaching people and getting them in training programs. And right now in Asia alone, we have 43,000 employees. So what we think is that to be able to succeed as a global company, it will be very important that we have a very global workforce, that we recruit here, we put them all around the world, we create a layered structure by which we do this multi-years, and we can at any point tap talent from anywhere of our firm that is already trained at our firm and that can perform anywhere. So
and
that's
a healthy and happy workforce. I'm glad you mentioned health, because that is one component of two sides to human capital development. One is education. You made a mention of it very extensively, but health is another, which is why I wanted to bring up to you, Olivier, you're with Sanofi Pasteur. You're at the forefront of discovering new vaccines for diseases we find endemic throughout the world. Your initial engagement with APEC started 3 years ago, if I'm not mistaken, and that you're now working closely with a number of APEC economies and actually pursuing a new approach, a very novel approach. And you find that this is the right time to actually do so. Why?
So for us, thank you, Katie. I'm very happy to be here. We are here for the third time. And, you know, everyone has a sense of purpose. Every company has a sense of purpose. And our sense of purpose is to contribute through our expertise, through our knowledge, to a better world, of course, but more importantly, to the well-being of APEC countries. There are a lot of things that are going on in healthcare. There are probably 2 or 3 main features that today are going on in that space. The first one, and this is why education, and I'll come back to it, is very important. So the first one is clearly more than 1 billion people today don't have access to efficient and affordable health care. The second feature is probably the growing non-communicable disease. Non-communicable disease used to be disease of the West, of the very developed countries, like diabetes, cardiovascular disease, or respiratory disease. Now it's obvious that things have changed, and more than 80% of the disease are taking place in the developing countries. So it's a significant change because in the upcoming years, if we collectively are not able to address through prevention those diseases, it's going to be a terrible burden for each and every minister of health and each and every minister of finance in any given country. The third feature is probably the persisting infectious disease in the world. We all know that there is no better healthcare intervention than immunization, but unfortunately, each and every year, 3 million young children die from a vaccine-preventable disease. So it gets back to how, in a system that is today, healthcare system that is today undermined by persisting infectious disease, by also growing non-communicable disease, how can we collectively, address and build a better world? It's probably through prevention. Prevention is definitely a way. It's better than cure. It's much more cost efficient. It comes at the end of the day from the action of the government in order to make sure that right programs are implemented, but also from the population, because health style is of course very important. And as much there are awareness that prevention, good prevention, would lead to better health, it's of course every population has an important role to play. And we have a couple of experience of programs that we have developed, especially dedicated to the children for diabetes, both for the management of diabetes type 1, but also for the prevention of type 2, that have shown very effective with trainees, with teachers playing the role of trainees and allowing to form a large base of children. It's obvious, and we all know it, that in order to put in place a large preventive program, it's obvious that if you have a very well-educated workforce or well-educated people, this will be much more efficient, as they will be paying much more attention to prevention. And it's obvious, there are a couple of examples that shows that a really very structured program of education leads to better prevention. You all remember that in the early 60s, Jamaica and Singapore were about at the same level in terms of GDP per capita 30 or 40 years after. You see the difference in the early 60s. Singapore decided to go for a very, very directive program for education, and step by step they have been able to educate and put in place very broad education program. The question at the end of the day, and I get back to what you mentioned with regard to dengue, is how you reconcile, market access and innovation. And the experience that we have with our dengue vaccine. Dengue is a mosquito-borne disease. I'm sure there are many people in the room that got infected by dengue. We have been working on dengue for more than 20 years. And what we have achieved, or what we are achieving here, is that working and developing a very specific pathway. Usually when you go for innovation, you start by the US, you start by Europe. Here we decided to focus first on the endemic countries. And this is why we have developed these vaccines in the endemic countries, so that it could impact firstly, the people that are mostly in need of the vaccine. So it shows again here that, finding a way to work together, public-private partnership are absolutely key to drive innovation. Of course, the private part is playing its role, but nothing is possible. It takes two to dance a tango. And in order, to put in place right prevention policy in order to build a very efficient healthcare system, multiple, public-private partnership are needed in order to build a better world.
Now that you mentioned prevention, that takes us all the way back to early education. I mean, if we were to inculcate in our young that this is the way to prevent a certain maybe endemic disease, we could probably build a more productive workforce. Which brings us to Ramon. You've made the advocacy your business, education with FINMA, education networks. You've managed to reach a wider expanse of Filipinos, teaching the marginalized how to live better. How important is it for a business like yours to actually promote inclusive growth and also teach children at the early stage so that they can actually prevent certain diseases?
Thank you, Kathy. It's a pleasure to be here. You've combined two topics in one. But
We're running out of time, but this is so interesting to just talk about two prongs in the human capital development.
First of all, for education to succeed in promoting inclusive growth or inclusive development, education has to be accessible to the poor, and it has to be relevant education. In the Philippines, as in probably most of the APEC countries, most families aspire to have their children be properly educated, of course. But even among the poorest of the poor, they put a very high level of priority on getting at least one of their kids educated properly, even to the extent of sacrificing some of their meals sometimes so that they can afford the tuition that will allow one of their children to get a college degree, which most people see as a passport to a better life. So that's the context for us at FINMA to decide to go into education. We're a 60-year-old company, and in the past we used to be in heavy industry, particularly in cement. But somewhere along the way, particularly as a result of the Asian crisis, we decided to reconfigure our business. And one of the thoughts that crossed our mind was, if we are to do something to help build this nation into a stronger nation, we really need to do something about our people. Our people are our main resource. So we said, maybe we should try to see what we can do about education. We decided to focus on education, but education for the poor. And that is obviously a great challenge. And let me put some context. When kids from public schools in the Philippines apply to colleges to become college freshmen, their competency level is at the level of grade 4 or grade 5 in terms of English, math, and science. Yet they're applying to become college freshmen. So the question you're faced with at the outset is, do we turn them away because they're not qualified to enter college? But that would make a life of poverty inevitable for them if you do turn them away. The other option is to take them in and say to yourself, I think I can work with these kids and do something with them so that at the end of their 4 or 5 year college experience, they will be in a position to take these board exams that will allow them to practice professions like accounting, nursing, medicine, law, etc., and take the same exams that the students from the best colleges in the Philippines take, and still pass them and qualify to be professionals. Well, we've decided that that's the challenge we will take on. And the way we've done it is we've decided to apply what we think are some principles of business to education. Focusing, for example, our definition of good quality education for the poor is education that leads to jobs. We're not trying to create Nobel laureates. We're trying to create opportunities for the poor kids so that they can have a meaningful life through employment. That means that we focus our course offerings on those courses that we think will produce the kinds of graduates that will lead to jobs. So we drop things like, well, maybe it's not good to give examples, but We focus on things like accounting, nursing, hotel and restaurant management, information technology, even criminology, and education. Education itself is a course that has been popular. So we focus our course offerings and we do away with the rest. That allows us to have more efficient classes. We focus on the quality of teachers. And the way we do that is we've acquired 5 schools since we started 10 years ago. And what we do is we pay our teachers the best in the locality where they are, so that at the very least we're able, if pay is an incentive to get good quality teachers, we're able to get the best teachers where we are. And then we tell our teachers that their job is to teach as well as they can. We're not emphasizing research, we're not emphasizing other activities. We're also trying to do away with the frills. All of that is designed so that we can make education good quality but also affordable. And what we've been able to achieve is we have now 5 schools with 52,000 students. Our average tuition is only $300 a semester, $300 US a semester, $600 a year, which by any measure is really quite low. Of course, free is even cheaper. And if government were in a position to provide high quality education at no cost to the students, then so be it. But in the Philippines, as probably in many other countries, there is a gap to be filled. And that's where the private sector has come in. So you keep tuition low and you help them along the way. Now, the kids who come to you, as I said earlier, are really not qualified to be college freshmen. They need a lot of guidance. They need a lot of support. They need a lot of psychological help. First of all, a lot of these kids are from rural communities, and it's the first time they're coming to live in a big city. So part of the effort is just getting them convinced that it's worth the effort, and number 2, that they can do it if they work hard enough. And then you show them role models of people who've done it in the past. It's a lot of guidance. What we've done is we've restructured the curriculum to a certain extent so that you don't burden them with too much academics at the start so that they don't get overwhelmed and they stay in school. Because part of the problem really with poor kids is they drop out. They drop out of school early because of the feeling that they can't cope. So you build up their confidence. We even have celebrations at the end of each year, something like a little graduation, just to say, you've done it, you're now ready to move on to the next year, and so on. Things like that. But of course, at the end of the 4th year, we have to get to the point where they're ready to take those board exams. And that's the whole process we've adopted. There's a lot of creativity, a lot of flexibility, and a lot of innovation in the way we do our teaching. But I'm very pleased to say that in the process of doing all of these, we've been able to improve, for example, in this country, one of the most publicly known measures of success is how well your kids do in these board exams that our kids take after college. And I just have some quick statistics that I jotted down to make sure that I remember them. In the period from 2009 to 2015, these are just some indicators of the success we've had in our schools. In accountancy board exams, in 2009, our passing rate was 38%. In 2015, it was 62%. In nursing, from 38, we moved to 83%. Secondary education, this is for teachers, from 44 to 71%. Elementary education, from 25 to 85%. And criminology, or criminalistics is what it's called in other countries, from 32 to 84%. I guess I'm bragging to a certain extent, but that's not the main point. The point is, it can be done. There is something that the private sector can do to improve the quality of education and still make it education that's relevant to the poor. Let me stop there, because there's another part of this, which is the relevancy part, which I think talks about the fact that the products of our educational system are not the kind of people that industry and the economy needs, but perhaps we can reserve that for later. Thank you very much.
Of course, and I'm going to be pulling the fulcrum to health, because we have the Undersecretary for Health with us in the panel. You really hit the nail on the head when you said that the conventional approach to both health and education are not adequate. And this is coming from a government official.
Yes.
Why did you say that?
Thank you, Cathy, for the difficult question, and I'm happy to be here. Okay, first I'll premise by saying that I'm happy that the APEC economy has come together in addressing regional economic integration and removing barriers to trade for many products and in some respects services as well. However, there is still a big gap in health disparity, in health outcomes in many of the economies. And in saying so, we're faced with a big burden of diseases. And the big burden of diseases can be combined into three areas. Knowledge gap or health illiteracy. Then we have the disease itself. People may die from it. And third, they go into financial crisis or poverty if they cannot afford, if they have to buy many of these products to save their lives. So having said that, then I move on to the next one. If we examine the vicious cycle of the problems that we have burden of the diseases. And in a recent study by APEC, Life Science Innovation Forum, together with ABAC, we found that there is an economic and fiscal implication to ill health, in that workers' productivity is heavily compromised, and that they're not able to work, they drop out, and they eat up resources like insurance, pension, as well as premature death will also cost the government money. So given that scenario, work productivity is affected, it then leads to more poverty for the family. And with lack of funds, they are more exposed to the elements. You can say infant mortality, maternal mortality, infectious diseases, and non-communicable disease are all part of this package. And as they get more poor, there is a bigger demand on government and society to pay and come to the aid of these members of our society. But there are solutions. The solutions is a development challenge for all of us, both in the business sector and in the government. And we can also include the whole of society approach. One that will be concerned with improving the level of education, that means addressing health illiteracy. And the second one would be to do constant reforms at multi-level, various levels, both in government and in industry. And the last one is to acknowledge that there are drivers to ill health that are beyond the health sector. And this is where we call the cooperation and collaboration of everybody, and this is addressing the social determinants of health. One of them is education. Thank you.
Thank you, Kenneth. Which brings me back to Nicholas, because you mentioned that disconnect. So many jobs out there, but when they graduate, they still find themselves without jobs. How can the government help? I mean, the governments of our 21 member economies help address that gap and narrow the gap between what the private sector can do to help people get jobs and ensure from the government side that there will be jobs for these people that you've trained, helped train from the start?
Well, I mean, there are a lot of initiatives around many countries to have private sector and government sector work together. And actually, Singapore is at the forefront of a lot of these things. And even in places like, in the Philippines, I mean, right here, we have 13,000 employees. We train all these employees. And we look for the government to help us also in terms of making sure that we can have the right facilities, get the right people from the right universities. So we have a lot of dialogue. And the point is, these people that we're hiring, they work with areas around the globe. And after they leave, they have real practical training. And beyond that, what we try to do is to instill into them what we call lifelong learning. So not only to learn what's at task, they need to be very adaptable. They need to be able to change as conditions change. So as the world changes, they need to be able to learn themselves how to look for the next thing. And that is, a very important component of generating a group of people that can, succeed in any environment.
Yes, Ramon.
May I? Yeah, this is where the point of collaboration comes in. I really think it's important for industry and academe to work together, and government as well, to work together to define, to come to a consensus on what the educational institutions should be doing in terms of the students who are going through the process. I think industry has a role to play in defining the competencies that they're looking for and the skills that they're interested in, and also in identifying the opportunities that are out there and projecting that 4 or 5 years forward, because that's the length of time it takes to get a degree. So to the extent that you can improve the level of collaboration, I think you will reduce that gap. In the Philippines, what we've done is we organize something we call Philippine Business for Education. And one of the things we've done is organize what we call summits, because here in this country we like calling things summits.
Like
But
we're having one right
we bring
now.
industry, academe, and government together, and we've had 2 of these, and they have been extremely successful. But among the most interesting comments, particularly in the first summit, was why didn't anybody do this earlier? This was, in their view, one of the first times that schools and government and industry were talking to each other precisely about this topic, the topic of what should the educational institutions be producing in terms of the skills, competencies, etc. We've gone further and we've institutionalized this into what we now call industry academe councils. And perhaps something that APEC or ASEAN can consider is doing this on a broader basis instead of just like what we're doing in the Philippines, maybe APEC or ASEAN or some larger groupings, especially now that borders are disappearing among countries and there will be more cross-fertilization of professionals among our countries. It might not be a bad idea to consider industry academe councils APEC-wide or ASEAN-wide so that we can exchange notes, learn from each other, and define competencies on a broader basis. Yeah.
Yes, Kenneth.
I'd like to resonate with that. In Cebu, we had this APEC SOM3 meeting, and on the margins, we had the high-level meeting for health and economy, where we brought together high-level officials in health, together with CEOs and captains of industry, where we talk about gaps. And everybody wanted universal health care, but at the end of the day, we all agreed that we need to strengthen all our health systems and put the resources where each they should be in order to address those gaps. One of the things we found out that the economy might be affected to as much as 9% of the GDP within the next 15 years if we are not going to address workers' health. And that's very, very shocking. And also the need to invest in preventive health care so that they will have a healthy lifestyle, to prevent them from getting into illness is one of them. We had development banks there, we had multilateral agency, we had stakeholder engagement, and we promised to have more dialogues in order to resolve, there would be differences. But we promised to get together to resolve these differences for a whole of society approach.
Well, we've got a solution coming from Sanofi Pasteur because you have a vaccine for dengue. Coming to the markets in a very innovative way. And I wanted to bring up this phrase that came up, flip the access to innovation. And I'm thinking that probably has a meaning to what our health undersecretary said about health literacy. How can we actually narrow the gap if we flip the innovation switch? And I can't quite determine how that happens until perhaps you get some approvals for the vaccine itself.
So I think what is important is that there are so many pieces that are moving. It's not one road. And Raman just mentioned that, of course, there's been a lot of efforts that have been developed by the education system, by the government, by the industry. There are so many pieces that are moving that we shouldn't think that we are able to resolve, at one point of time, each and every issue. It's a continuous process. And it's a little bit, what we do in terms of innovation. There is not one pathway. There used to be one pathway. No, there are very different pathways that can be used in order to make sure that, everyone get access, of course, to innovation, but of course, finding also a way to stimulate innovation because we all know that innovation is a very lengthy process that takes an awful lot amount of energy.
And Kenneth, in terms of the health department, I'm just very curious, what are the processes involved when a vaccine like this is coming and it's just requiring approvals? It's at the gate. And all you have to do is open the doors, and Sanofi Pasteur is waiting for that. Is the Philippines, in terms of processes, is there a lot of bureaucracy, perhaps, that gets into the way?
Sure. The Philippine government is very receptive to this. In fact, we welcome these kind of innovations because they're dealing with neglected tropical diseases where normally these things are not invested on, and we're very happy with this. There is a technical process by which the regulatory agency will have to review documents and dossiers and the like in order to ensure that the quality, efficacy, and safety being the key determinants of approval for a drug. But it's a work in progress, and it looks like it's very positive in the horizon.
So it's not going to come this year?
I'm not going to speak on behalf of the FDA.
Just trying my luck there. But I wanted to put in education in there as well with health literacy. That is so important. But I want to understand, as you work through education for the poor, how can you actually put that into your curriculum to ensure that you get health literacy right in there at the start, when the child starts school at FINMA?
First of all, the issue of health does involve health literacy. But first, just before going to that topic, I think the issue of nutrition is very important at the start, by the way. And it really needs to be addressed at the earliest years of education because it does affect brain development, literally. And to the extent that your brain development is affected, your ability to learn is really affected right at the start. So the most effective nutrition programs are those that are introduced at the earliest learning years, I think. So that's very important, number one, and that's something that we're interested in. On the whole question of health literacy, of course, this is something that really the Department of Education should be thinking about as they design the curriculums for basic education. And I totally agree. I think prevention is a much better strategy than looking for cures later on. So to the extent that prevention can be achieved by better health literacy by all means. And of course, we are very happy to cooperate and include those in our curriculums. But that is the work, I would think, of the Department of Education, so that because they dictate the curriculum for basic education, and that becomes widespread.
It's all a work in progress, and I wanted to ask the audience if they had questions. We have about 13 minutes to go, so if you have questions from our dignitaries in the front, we have microphones that will go straight to you. If you have any questions to our panelists, please identify yourselves. If you have a question, say your name and where you come from and to whom you would like to address a question. We have about 13 minutes for this. Anybody? Yes, sir.
Good morning. My name is Yitzhak Peterberg. I'm the chairman of Teva Pharmaceutical. This is the leading generic company in the world. And I'm for the first time here in APEC, searching.
Welcome to APEC in Manila, perhaps. Your first time too.
So my question is really maybe on the health side, because I heard in the session before speaking about genomics, I heard you speaking about, all kind of solutions in healthcare, and I have a question about access to healthcare. Because I think one of the biggest problems around here is really access to just simple care, seeing a physician, access to drugs, affordable, quality drugs. And I didn't hear anything about it. So I would like, if you can comment a little bit about how do you see the part of innovation, the basic innovation in these parts, things like digital health, things like other solutions that can help you. Thank you.
Shall I answer?
Yes, please.
Thank you, Professor, for your question, and welcome to the Philippines in APEC. Admittedly, there are inequities to healthcare, and the access is not, there are wide disparity. And this is one of the reasons why we're coming together to use innovation to solve it. I understand telemedicine, and digitalized medicine is one of the ways to address this, especially in far-flung areas where there are no health professionals. There are root causes to this problem, including proper incentives to be given to these healthcare workers, and we're looking at how to do a sustainable financing. It's still a work in progress. We admit it's not a perfect solution, but it's still out there. But we're happy to collaborate with industry and other government agencies to look for meaningful solutions that are sustainable and cost-effective, of course.
If I may just continue,
Go
you have
ahead,
a big job on the regulatory side, because if you want to play in Asia, TPP is very important to help us on our way to bring better drugs in cheaper prices and very good quality. Sure. And this is your job to pave the way for us. So the private companies can come in, but we need the help of the countries.
And APEC indeed has launched, through the life science, good regulatory practice and regulatory convergence as part of our agenda.
So it's still work in progress, Kenneth. Any other question from the audience? We have a good 10 minutes. Yes.
Kim Campbell from Auckland. Hello, hello, hello.
Thank you.
Kim Campbell,
My
Auckland,
name's
New
Mike.
Zealand. Among other things, I'm a director of quite a large generic pharmaceutical company called Douglas. And one of the issues that we face, we want to bring health to the region, is a lack of alignment of the regulatory framework. There's an enormous amount of cost in registering any drug. And every time you go to a different jurisdiction, particularly in Asia, you get a completely different story. And I just wondered, with you, particularly to the Secretary, if you have any comments to make about, first of all, the lack of progress in aligning the various jurisdictions, or if there's even any real serious intent to do so. And this forum is one place where I think that should be discussed, because I think it would make a big difference to lowering the cost and making drugs generally more available to people.
Yes.
Thank you for that question. Indeed, that was discussed a number of times under the Regulatory Harmonization Steering Committee under the Life Science Innovation Forum. I admit that it is a very challenging prospect to get economies to align to a process, but in fact there is a harmonization process going on. And again, we will get there in terms of regulatory convergence. And in fact, we're exploring terms like regulatory reliance to fast track many of these products to make it accessible to people.
I've seen a gentleman over here.
We accept the challenge, yeah.
Yes, we have a question. Yes, sir, please go ahead.
My name's Michael Blum. I'm from the
Hi,
U.S.
Michael.
and I have a background in development and manufacturing of medical devices, and also now as a venture capitalist investing in startup companies globally. Recently, over the last several months, we've attended several medical device innovation seminars primarily in the United States, Silicon Valley area, and I'd like to maybe present a little challenge to the panel, realizing the challenges that are in front of you now in bringing healthcare to a broader percentage of the population, to the entire population. Yet in seminars that I attend, you have companies that are talking about innovation for the future. And by the future, in many cases, they mean a population that is going to be very old. Yeah. Our grandchildren can look ahead and plan to live to be 120 to 150 years old. How are you going to spread that finite amount of dollars and resources you have over a growing population and a demographic population that is going to rapidly change? It's going to be quite a challenge. I think someone said 9% of the GNP would be really challenging.
Yes, that will be the Health Undersecretary.
I submit
Kenneth,
to you
yes.
that may be not even half enough 50 years from now or 30 years from now. Thank you.
Did anyone want to comment?
That's you again. No, I think challenge accepted. The solutions are very difficult. We admit that there's a growing aging population, especially in mature economies, and low birth rate in some of these economies as well may contribute to, that's why we need to do the prevention part much, much earlier than what we were trying to do earlier. I think at the end of the day, even with innovations, governments will have to look at cost effectivity or cost effectiveness. Because the resources are meager, they have to make some hard choice and decision. And this is where I think collaboration with private and public sector comes in very importantly. But thank you. We accept the challenge.
Yes, Olivier.
Yeah, I would complement your question in saying that it's obvious that at some point governments will have to make decisions to allocate, their available resources. In other words, and I get back to prevention, if we don't make significant progress, in terms of prevention, we are going to be facing at some point a wall with the, of course, the aging population. So a lot of efforts will have to be done in order to take those new costs that are going to be incurred due to the aging of the population, and we will only be in a position to deal with them if we are in a position to significantly improve, the efficiency of each dollar we spend today in healthcare. And definitely prevention here is definitely one of the solutions. There is no magic bullet, but it's one element of the solution.
Anyone else, perhaps for a final question before I have our panelists wrap up the discussions? Yes, ma'am. The lady in red, please.
Good morning. It's Christina Ampil with PricewaterhouseCoopers. I'm quite intrigued, Mr. Del Rosario, about the systematic efforts you're doing between industry and academia to turn students into productive workers quite in an accelerated way. And I think APAC and PwC have thought that the new principle for 21st century talent mobility is exactly some kind of standardization of credentials so that they can move freely across different countries. So my question to you in health and education is, which occupational categories are ready for that kind of standardization of credentials and portability of credentials across economies?
I understand in the Philippines, the engineering profession is quite at an advanced stage in terms of establishing credentials that are accepted region-wide. And I think there are efforts in the other professions to try and do that also. But I think this emphasizes the need for more collaboration, really, where industry and academia come together and together define those credentials and accept those credentials that they think will really be valid as we move forward. And then the whole idea of expanding this collaboration to a region and maybe to even as broad a group as APEC is precisely in the context of this cross-border movement of professionals and allowing credentials to be recognized as you move from one economy to another. So there are efforts that are taking place now, and I understand that the engineering side is the one that is more advanced in our country, but there are efforts going on also as far as other professions are concerned.
We have about 3 minutes to go, and I wanted our panelists to say a bit of a wrap-up before we all end, and I wanted to start with Olivier down to Mr. Nicolas, please.
So we are working in a world that is getting more and more complex. And in order to solve the issue that we have in front of us, it's not anymore at the scale of one organization. It's the scale of many organizations that will be able to work together. So the big danger for all of us is to work in our silos. And working in our silos, we will never be able to resolve very complex issues. So the more we are able to work together, the more we are able to design the future together, the more we are going to be successful.
Thank you.
Kenneth, collaboration, please.
What we have in front of us is a development challenge, and it needs a whole-of-society approach. Governments must also get their act together in terms of doing sensible regulations, both for trade and for products. And industry must comply, of course, with quality, efficacy standards as well. I'd like to say also that, and also prevention, I mean, data have shown that a $1 invested will bring something like $37 of savings in the future. So prevention, health literacy, in fact, is the key to the problems that we face. In the past, we thought that health has to handle health problems, but not so nowadays, because social determinants of health is the key word that we need to address.
Just very quickly, for health investment, what percentage of GDP should it be at so that we can achieve such growth?
There is a traditional concept of about 5%, but it doesn't really matter as long as the outcome is addressed. So it could be as high as 10 or as low as 2, but it depends on what is your base to begin with.
Ramon?
I would appeal to our business CEOs to consider education as part of the scope of responsibility that they have. There are opportunities for business to participate in education. As I tried to make an example of what we've been able to achieve, I think there are many opportunities of that sort. But other than that, there is an opportunity to participate in being involved in defining the competencies that come out of our educational system, even participating in the design of curriculums, particularly for those professions and jobs that we are interested in. Be actively involved, participate, and let your voice be heard so that you will participate in defining the future of education in your respective countries.
And Nicolas?
Thank you.
Yeah.
Thank you.
So the world is clearly becoming more global thanks to forums like this, and in that context, We see that technology is changing very rapidly. Capital is moving from country to country. Labor is starting to move back and forth really quickly. And to be able to succeed nowadays, you really need a global workforce. And to do that, you need to invest many, many years. I mean, it's not about I'm going to do this for next year. You need to invest for the next decade. So the sooner that we start, the better.
Healthy, happy, and educated workforce. This all contributes to productivity, which we all need for our APEC economies. Thank you so much for our discussion leaders, Kenneth, Ramon, Olivier, and Nicholas. Thank you very much. Really appreciate the time. We'll have a networking break and be back in 10 minutes because we will have a summit focus in cities, which I'm very interested about. What is a livable city? Is it Manila? We'll know the answer in 10 minutes. Thank you so much. Thank you.